Hey, what's up, guys? It's Ryan with Revolution Performance. I wanted to share with you guys today why I think telehealth can be effective in physical therapy. I hear a lot of times that physical therapy isn't appropriate to use a telehealth platform because it is such a hands-on profession. And it definitely is, but I would argue that a lot of the skill and value that I provide as a physical therapist is more along the lines of education, programming, and things like that related to your condition. And I think a quote that I love that summarizes that pretty nicely is injury occurs after doing too much, too quickly, after doing too little for too long. So especially, me working here at Train 24/7 Fitness House, gym going population is a lot of who I see. So a lot of the injuries I see in lieu of that is, due to training errors. So whether that's, you're working up to a certain movement, worked up to it too quickly or went too intense too quickly, led to more of an acute injury or something that happened quickly, or you did, say a certain movement or a group of movements too repetitively or too much volume in a shorter period of time, leading to more of an overuse injury. Either of those can turn into chronic injuries that go on for a long time as well. Going through programming and fixing those errors, finding out what you're doing that might be leading to the injury, that's obviously all things that you can do through a telehealth platform and still deals with the injury appropriately. The other thing to consider is obviously corrective exercise, which is what a lot of people think of first when you think of a physical therapist. You think of, the exercise and treating injuries in that way. That is something that can be done pretty handily through a telehealth platform as well. Through the coaching and cueing and things like that, without having to have that hands-on component. What I think is super valuable as well is the form technique analysis. So, taking a video of whatever motion you might be struggling with, whether it's a squat, deadlift, anything like that, and going through the form of that. I think that can almost be superior to do on telehealth because you're able to shoot the video. You can draw angles. As far as joint angles, torso angle, where your body is in space as you're doing that movement, and after you have done that, you can play the video back to yourself in real time, which I think is can be really valuable for people to see that, to actually see what's going on, see what they're doing wrong, and potentially improve it to help out their pain or condition and whatever it might be. The other thing to consider is that in Ohio, as a physical therapist, my license covers me throughout the whole state. So obviously, logistically, everyone from every location in the state isn't willing to drive to come see me where I'm located here in Central Ohio. But through telehealth, I can see, anyone in Ohio and still be covered by my license. So I'm from Findlay, Ohio. Spent a good deal of my time there because that is where I went to physical therapy school. So if you know me from Findlay, Ohio, that is a way you can still work with me and get a good bit of value without having to make the drive to where I'm located here in Central Ohio. I'd say the only thing you can't do through telehealth as a physical therapist is obviously that hands-on component. That people argue as the reason you can't do telehealth and physical therapy. And that includes, of course, like dry needling, joint manipulation, cupping, that kind of stuff, where you have to actually physically be in person. And don't get me wrong, I love those things. They can definitely be helpful for a lot of conditions. But there's also a lot of things, going back to what I was talking about as far as training errors and things like that. There's a lot of things that you can improve, at the very least improve, if not completely get rid of. Just through the things we were talking about with telehealth. So it's not, those hands-on things aren't completely necessary to completely treat every condition. They can be nice and they can definitely speed up the process a lot of times in terms of a treatment approach, but not entirely necessary in 100% of injuries. And obviously a large portion of the skill of a physical therapist is that first session we would have through a telehealth platform would be kind of a screening to make sure it's an appropriate injury to be seen through a telehealth means. So that was a little bit longer than I was hoping it was going to be, but good stuff. I hope you guys found it helpful. Maybe consider telehealth, especially as we get into the colder months. Or like I mentioned, you might be outside of the geographical range, but still live in Ohio and want to be seen for something. So take that all into consideration. I think that's all I have to say on that today, guys. So think about that. Let me know. Obviously, you can DM me or go to my website to set that up. You can schedule online on your own, which I think can be super helpful as well. So thanks, guys, and I hope you have a great day.